Hi, everyone. I'm Michael Kuluva, and today we're going to be talking with Codie for the Talk Over RA campaign 2023. Codie is from Arthritis Research Canada, and we're going to be talking a little more in depth about inequities in the Canadian healthcare system, a little bit more specific into minorities, the LGBTQ plus, two spirits, and really going into a little bit of what really happens within our healthcare system and how we can improve it a bit. I'm going to introduce myself. I'm Michael Kuluva. I am a fashion designer. I'm also a rheumatoid arthritis patient. I have been working with Talk Over RA for about 2 years now, and I love their mission and their goal to get more information out to patients and patient advocates. I am also a fashion designer that loves to go beyond, and I like to go to Los Angeles and to Toronto and back and forth quite a bit. So I travel a lot. But yeah, I always like to do these discussions and try to help out anybody out there that is also having these same discussions or have questions about this. So I'm going to now pass it over to Codie, and he's going to introduce himself.
Yeah, thank you for having me, Michael. I'm really excited to be here and happy to share and have a discussion about this topic. Yeah, so my name is Codie. My pronouns are he, him. I am originally from Ontario, currently living in British Columbia, in Vancouver, the unceded territories of the Coast Salish people, including the Musqueam, Squamish, and Tsleil-Waututh nations. So my kind of area where I fit into this type of discussion, I have a couple different hats. I am a researcher, so I've done research in arthritis as a whole, 2S LGBTQI plus health as a whole, and kind of dipping in a number of different areas with respect to that. I'm also a recent graduate from a physiotherapy program and starting my clinical work as a physiotherapist. And on the side, I also am a semi-professional dancer, and I do that in kind of my spare time. It keeps me kind of level and balanced with the work I'm doing in my day-to-day. But yeah, that's just kind of a quick little introduction to who I am and where I fit into this space.
I love that. I didn't know you did dancing for a passion. I used to be a figure skater, so I do love that.
Wonderful. Love that.
So diving right into the conversation about the inequities that we have in the healthcare in Canada for arthritis patients and more specifically within minorities, such as the LGBTQ plus two spirits. What do you think are the main challenges that we're facing right now on finding healthcare access for minorities with arthritis?
Yeah, I think there's a lot of different areas that we can explore in that question. I think that there are very distinct challenges with respect to geography is a big one, and where individuals are. Individuals that are living in more remote communities and just not necessarily having the same access to care and having access to multiple different healthcare providers that can provide the needs that individuals need. And that's kind of one area I think that we're trying to work towards making improvements in the ways that we can do that, but we still have a long ways to go with that. Another area, and this is kind of a big passion of mine, is just how equipped we are as healthcare providers to provide care that is, culturally sensitive and competent. And if we're talking in the lens of 2S LGBTQI plus health, that's gender affirming. And I think that, again, we're moving in a direction that we are providing a little bit more knowledge in areas that are more specific towards, disproportionate effects that it has on these communities, the way that the healthcare system is set up, and just social structures and how that has an impact on health outcomes. So again, I think things are moving in a positive direction, but we definitely have a long ways to go with that. And I think that a lot of it stems as well just by how research is done and how individuals from underrepresented communities are reflected in those research studies. So by design, our system is built on a very, let's say, homogeneous group of individuals that we're basing all of our medical knowledge off of. And we have learned over the last number of years that it doesn't necessarily apply to everyone in the same way. So as we start to do a little bit more work in trying to understand how it affects individuals from different communities, that may improve our ability to be able to provide care that is more representative of the needs of those individuals. So I'm excited to see kind of where that work moves forward in the future, and hopefully being able to improve health outcomes for individuals whose health outcomes right now just are not where they need to be. So yeah.
Yeah, and you did touch on a really good point. There's a lot of rural areas in Canada. I live right now right outside Toronto in Ontario, and there is a lot of rural areas. Kind of diving into that a little bit. If you're living out there and are in a rural area, and what do you think? How can we pivot the access to healthcare for people that are just not available to get to a large city? Is it
Yeah.
through virtual clinics that we're going to be going through? I know I've done it personally, and I think that they're great. But I wanted to hear your take on it.
Yeah, and that's a great point. Like the virtual clinic piece of it, I think is a huge component that can help with that. Um, with the COVID-19 pandemic, there was obviously a lot of not so great things that came about with how things went. But I think one of the really great things that did come from it is that we so quickly adapted and started doing more virtual care on a wide scale. So just kind of the like turnover of how quickly that happened was very impressive. And yeah, I definitely think it has a place. You don't necessarily have to live in a rural community. I think it has a place in a general context in healthcare. But yeah, for rural communities, it's definitely something that can be helpful. There are a number of different people working in designing and structuring virtual type programs in more remote communities, which has helped provide better access to care for some individuals. I will say it doesn't necessarily solve all the problems. There's definitely some things that you do need in-person care and assessment, and if we're talking into diagnostic imaging or things like that, then there are definitely some considerations that need to be taken into account in that regard. But yeah, as a general idea, I think it can be very, very helpful, and it has already helped a lot of people in being able to get better access to care than what they're already receiving. I think that other options that can be really helpful, there are a number of different individuals that provide home care. So, different healthcare professionals, it could be a physiotherapist, as an example, do travel to more kind of remote areas and provide services for care. It really depends on kind of where you are and who's around, what services are provided, and we don't necessarily have that everywhere. But I think, again, we're moving in directions of having better access in that regard. Doesn't solve all the problems, but I think it's definitely helping.
Yeah, I agree. I think it definitely helps as well. And I've been in situations where I can't get to the doctor myself, and having them being a virtual consult or clinic that they have and being a part of that really does help, even just with somebody that doesn't live in a rural area. So you're
Yeah.
completely right about that. I also know that a lot of prescriptions can be sent home now. You can do it over the internet. You don't even have to see, a doctor in person anymore. So things can be sent even just directly to you, which I think is great, especially for people that are in those other communities that are not close to a pharmacy.
Absolutely.
Um, do you think virtual clinics is the best way to shape the healthcare system for the lack of physicians in Canada? We've been really struggling trying to find physicians and nurses since the pandemic, and this is one way of still being able to provide some sort of healthcare, even if a hospital is closed or if there is no more funding for some community centers. Now, this is maybe an alternative, and your thoughts on that?
Yeah, and that's a really great question. And I think that it definitely has its place in solving, some of the access issues that we have right now. Again, saying like with what I was saying before, it doesn't solve everything because there's definitely some, safety concerns associated with it. But I think it can be really beneficial in complementing in-person care and potentially minimizing the burden even for individuals to travel, right? So if someone's up north and they have to travel down to like where I am in Vancouver a couple times a month, every trip is going to cost them a lot of money too, right? So saving them funds in travel expenses and potential accommodation expenses depending on what they need to come down for, I think, yeah, it just helps streamline that process a little bit. I think that having systems in place to make sure that the way that we're doing that initial assessment with individuals, if we're doing it in a virtual context, making sure that we're addressing all safety concerns. And I think that in a lot of ways, depending on the health profession, the way that we go about doing diagnostics based off of a clinical history without the need for imaging, again, depending on what we're looking at. There's been a lot of movement forward, and we're actually really good at being able to identify things just by getting a clinical history and asking individuals the right questions. So that can give us some good context into, do we need to bring this person in, or is it something that we can really address over a virtual visit? So as long as we're doing it in a way that we're making sure that people stay safe and they get the care that they need in the way that it needs to be delivered is really important. Mm-hmm.
And that's a really good point up to what I'm going to talk about next. Is the waiting period to see a physician in Canada is quite long, especially for some specialists. Like I know I've even been triaged for 12 to 18 months for some specialists that are here in Ontario. Do you have any suggestions on what to do in that meantime when you're in that holding pattern? I know it's a little bit frustrating for some patients when they're really wanting to see somebody within rheumatology, but there's just only one or two doctors in town and they're overloaded already. Do you have any suggestions about that?
Yeah, that's a really, really great question. And I think from the conversations that I've had with, individuals with different rheumatological conditions, seeking support from other individuals has been really helpful for them. Word of mouth, learning things from other individuals who have had similar experiences has been really, really helpful for a lot of people. There are, if we're talking about arthritis as a whole, there's so many different patient-led organizations that are available, in Canada, where resources and information are available to individuals. If we're talking about, that wait period to see a rheumatologist, well, are there things that we can be doing to try and manage our symptoms? There are definitely things that we can be doing, and a lot of that information is available through those patient-led organizations, community organizations. So you have a lot of information through the Canadian Arthritis Patient Alliance. They have a lot of resources and discussion group type environments where you can connect with other individuals who have had similar experience or are living with similar experiences. Arthritis Consumer Experts, Arthritis Society Canada, Arthritis Research Canada, where I'm working right now. There's a lot of really great organizations. If you go to their websites, there's resources that are available there too. And there are a lot of things that can be done as you prepare to go see a rheumatologist as well by seeing allied health professionals. So if we're talking about some pain experiences that you have, or fatigue and just navigating that, there are other like physiotherapists, occupational therapists that you can also be seeing that can help support the needs that you have. So I would think it'd be great to explore some of those. And kind of as a physiotherapist and my bias in this, just trying to stay as active as possible within what you can do. The more you're able to move in your day to day, typically will have a good benefit in so many different aspects of life, and hopefully can help with symptom management as well. So that would be kind of the biggest advice that I have too.
That's great. No, I totally agree with you. I always am on the treadmill for at least 30 minutes a day to try to just walk and get my body moving. And I know that if I can't do it for a day, that it's just going to get worse. So I really appreciate that advice too, because that's something I do live by as well. Um, Getting a little bit more specific into like the LGBTQ plus communities, how do you feel that they are adequately getting treatment for arthritis? I know that a lot of doctors, even in just other areas of the world and just everywhere, they can be a little bit discriminatory against the community. They could also not validate some of the symptoms that we tell them. Is there anything that you would suggest to kind of navigate that within our community?
Absolutely. And I think that at the end of the day, the best way to do that is to find organizations and individuals, healthcare providers that are 2S LGBTQIA plus inclusive. I know we're in a bit of a situation right now in Canada where access to healthcare providers as a whole, like a lot of people don't have a GP, like a general practitioner, family doctor. There are, depending on where you are in Canada, there are different organizations that are set in place that can help put you in the right direction and guide you to where you may be able to access more kind of 2S LGBTQI plus inclusive care. So in Ontario, Rainbow Health Ontario is a really wonderful organization. They also have a lot of great resources on their website. There's also opportunities to connect you with other healthcare providers that are 2S LGBTQI plus inclusive. In BC, there's Transcare BC that is also another really, really great organization that, you know, if you visit the website, there's a lot of really great information in terms of accessing healthcare, connecting you with healthcare providers that are, you know, gender affirming. Depending on kind of what area of health you're looking at, sometimes there are websites available where you can put specific criteria in what you're looking for in a healthcare provider. So I'll use the example with Pelvic Health Solutions is if you're seeking pelvic health, they have opportunities for you to be able to seek healthcare providers based off of a number of different criteria of what you're looking for in a healthcare provider too. And then if we're looking at the mental health side of things a little bit more, and you're looking for a mental health provider that can fit a little bit better with kind of the relationship and you feel a little bit more connected to. MindMap BC is a really great program that has been developed. Again, you can access that all online and look for healthcare providers that are 2S LGBTQI plus inclusive. So there's a lot of really great systems set in place to try and help connect individuals with the people they need to be connected with. But word of mouth is also really great for that. Like for myself personally, like as a queer individual, I learned about an NP, a nurse practitioner that is 2S LGBTQI plus inclusive through a friend. And then I contacted them myself, and now I have an NP that I'm very comfortable having conversations with. So yeah, word of mouth, asking people is always really helpful too. But yeah, at the root of it, just finding providers that are more inclusive. And I think as an education system and multiple different lenses, we need to be doing a better job at providing more inclusive spaces in our education so that kind of feeds into clinical practice as well.
I agree completely. And those are great resources. Thank you so much. I didn't even know about some of them, and that's amazing that I'm gonna have to check a few of them out, especially for the ones here in Ontario. And that kind of goes into the next thing I wanted to discuss is my own personal story of just having a rheumatologist. And he was an LGBTQ plus community member. He identified as queer, and it was something that I thought was going to be a perfect relationship. However, it did not turn out that way. So, not, of course, not saying that it always has to fit the same mold, but you know, I always felt that our rheumatologists here where I live are just overwhelmed so much. The staff really is sometimes overwhelmed themselves that they become rude to the patients. And then the other things get overlooked, like your symptoms, your fatigue, your lab work, or even your appointment. I've experience with my last rheumatologist, it wasn't very good. And that was probably one of the last times I went to see him until I got transferred, because I went for an appointment and literally I had it on a card and everything given to me. And I walk up there and, oh no, we can't see you today. The doctor is too busy. And I said, well, I have an appointment. I'm not sure, what to do. Oh, he can see you in about 6 months from now. I was like, what's happening here? This is not what I expected when I was going into my appointment. And it also has an effect on my medication too, because it has to all be um, approved by the physician. So it is a little bit of a little bit of a matching game, trying to find the right physician that works with you. Like you said, word of mouth is great, and that's what happened with me. Is I found my next rheumatologist through word of mouth, and I'm so grateful that he took me on, because where I live, there's only a few rheumatologists and it's a very small community.
Mhm.
Also, my personal experience too is that my old rheumatologist, he actually moved outside of where I even lived. And just to travel there, as you said before, for you, it becomes a whole ordeal of just trying to get there, especially in the winter when things are not amazing outside. It makes it even more difficult with somebody that already has a chronic illness to try to get to an appointment, and the weather and the outside natural forces are working against them. Codie, do you have any experiences that you'd like to share that you can go with Inequities?
Yeah, and thank you for sharing that. I mean, that sounds very frustrating, and I can imagine it, just trying to navigate that. But I'm happy to hear that things
Yes.
have moved in a direction that you have, the care that you need now, and you're comfortable with who you're working with. Um, yeah, for myself, I mean, on a personal level, I've definitely had experiences where even just walking into a physician's office and hearing conversations that are happening even in like the waiting room, or hearing like what's happening in the hallway, and like discussions are happening that way, where some comments may be made that, although the intent is not necessarily to harm or cause discomfort for people, it's not about the intent, it's about the impact. And hearing that, knowing that, I don't necessarily feel comfortable seeing this healthcare provider, because I don't necessarily feel like they see me as a person in who I am, in my identity. So I think that, yeah, it's a culture thing, and it extends beyond just healthcare. And, you know, I'm sure we've seen a lot of the things that are happening on a social, I'll say quote unquote political level, because it's turned into a political thing, but to me it's a human rights thing at the end of the
Agreed.
day.
Yes, I agree.
But yeah, that bleeds into kind of the healthcare system as well. So yeah, just like not so positive experiences with healthcare providers doesn't happen all the time, but it's definitely happened. And having conversations with other individuals, I know that that's happened. And even having conversations about things like accessing prep, like the
Mhm.
comfort level, and being able to approach that discussion depending on the relationship you have with your healthcare provider, and whether you feel like, am I in danger? It's a place I've been before. So yeah, that would be one thing, from my perspective. I also know a lot of other individuals, like friends of mine, who just the lack of access, and like not knowing who to go to, individuals who are in the process of transitioning or have transitioned, just trying to find the right people to be able to provide the care that they needed, was challenging and expensive for a lot of them. So yeah, there's definitely, yeah, in terms of access to care, there's new systems in place to support the process of transition for individuals in different settings, but it's not available to everybody everywhere. So from like a financial perspective, inequities are present, in that regard. But yeah, those are just a few things. I mean, I could probably talk about other things as well, but yeah, there's definitely things that we can do a better job with in the healthcare system in that regard, for sure.
Great. And just kind of moving to our final questions. The last one is, if you're a new patient, and I was, how do you navigate the Canadian healthcare system? Like if you're just starting from scratch, and I think we kind of touched on a little bit before that we have those resources at our fingertips, which I always suggest. And I know you're probably going to suggest it too. But anything else that a patient can do, they're brand new to Canada. They have no idea how to even start besides they just got their health card.
Yeah. And I would say I've had a lot of challenges just trying to navigate paperwork and the things that you need and all of those things. The thing I found most helpful is asking other people who've been through it, because that's really the only way that I've been able to get through some of these things, because you think you have everything and then you meet a dead end and you're like, I don't know what to do now. But then having access to community groups, like there's a whole bunch of different Facebook groups out there, or like different forms of social media have different groups where you can connect with people who have gone through those processes, and having conversations with them about what they did and what worked for them and what didn't. I find that people are more than willing to help share that information and help people get to where they need to be. So that would be one way of doing it. But the word of mouth and support from other individuals, I think, more than anything else, has been the most helpful for individuals. But just patient-led organizations, like you said, resources that are available out there. I've talked about some of them. Those are helpful. And then there's more condition-specific organizations. So we talked about arthritis a little bit, but more community-based organizations as well. So things like in Vancouver here, like the Health Initiative for Men, or Community, or different resources focused on like 2S LGBTQI plus health as a whole, can be really helpful in guiding that as well.
Well, thank you so much. That was amazing. And we are able to get so much information from you. I love how much information you have to give. I really want to thank you so much for being here today and answering these questions for us. I think that there's a lot of things that we can improve on. There's a lot of things that are going really, really good in the right direction. And I think that if we keep the conversation going, keeping the awareness up, is how we're going to talk over RA. So I'm so glad we're able to do this campaign. And I'm so thankful for you to be a guest today with me on all of these hard and difficult questions that we do need to get answered. So thank you so much.
Yeah, thank you so much. And thank you for inviting me to be here. I mean, I'm really happy to see that these conversations are happening, and that, Talk Over RA initiatives like this are happening, because, it's really important to be able to share and have discussions with the community as a whole. And I think it's really, really great that everything that the organization is doing. So thank you for inviting me. Happy to
Thank
be
you. And if anybody wants to find you anymore, are you on Instagram? Are you on social media at all?
I do have more of kind of like a research clinical account on Twitter that you can contact me at, or I also can share my email, that my like work email, that you can email if you have specific questions about resources or things like that. I'm happy to answer, so I can share that with you, and maybe you can include it with the video as well. But
Sounds great. Yes. And you always can find me at Michael Kuluva on all the social media platforms, michaelkuluva.com as well. And yes, we will add that to the description as well for you, Codie. Thank you so much, everybody, for joining us. And I will see you guys next year. Bye.